Hey guys, welcome back to my channel, and if you're new here, my name is Kristina. In my videos, I talk about nursing school because I'm a nursing student, as well as a plant-based diet and my cancer journey. If you like these types of videos, please like this video and subscribe down below. In today's video, I'm going to be talking to you about clinicals in nursing school, my experience during my first semester, as well as up until this point, which I am in second semester. So let's get into it. Initially, when you start clinicals, they'll be telling you certain things that you have to do prior to going to the hospital. So at my school, they made us practice vital signs as our first checkoff, and what that entailed was us having to practice on 25 different students, or you could do the same person. I had to do it on my husband like 10 times, not his favorite, but I got it done. So we had to practice doing that, and then after we practiced doing that, you had to meet with your faculty at a certain date and time, and you had to be checked off. So the highest score that you can get, of course, is 100, but if you don't pass your first time, then you have to do a repeat, and then the highest score you can get the second time is a 77. But most people don't even get that far, so don't worry. So during your checkoffs for vital signs, the things that you need to know are you have to be able to take someone's blood pressure, you also have to do a pulse, and the respiratory rate, or what they abbreviate as RR. Those are the three things that are key to know when you're doing your checkoff so that you'll be able to go to the hospital setting. On my first day of clinicals, I can remember it to this day, but it was such a great experience. I wasn't able to do much because all I was checked off on at that moment was vital signs and a few other things. Like in our previous class over the summer, some people took it at different times, but I had to take it over the summer before I started nursing school because I'm in an accelerated program. We had to learn, or we had to demonstrate that we were able to make a bed. So we had to I had to do it on my own bed and take a video of it. I also have to do proper hand washing technique, which is super important, especially when you're going to the hospital setting and dealing with patients. And then just show different aspects of nursing prior to going to school. We also had to discuss how to help a patient out of the bed and proper safety measurements before going to the hospital, like providing them with a call light, lowering the bed. If they're asthmatic, you want to make sure that the bed, the head of the bed is raised. So those little things are super important when you're dealing with patients. And in the beginning, it is a little frightening because you're not used to having actual patients. You're used to having mannequins, or you're used to not even anything, going from 0 to 100 real quick. But overall, I think that the experience was awesome, and up until this point I still love it. It's very intimidating because you have to get an ID badge, and you have all these things coming at you, these paperwork that you have to sign for the hospital and stuff. But I promise you, it is so much easier than it looks, because when you get there, if you're like me, when you get there, you just have this sense of calm because you feel like this is what you're supposed to do. If you know that nursing's for you and you love patients and you love being in that medical setting or hospital environment, then you'll know right away once you're there. So I was able to be on a orthopedic floor, and I had so many patients that were in and out of surgery, and they had different things going on with them after surgery, so that they needed to be followed and just to make sure that everything was going well. So I was able to perform another one was the bed bath. So you have to know how to give a patient a bath, and that's important to know, because if you have staff that aren't able to do that, or if you have some downtime and you want to help other people out, then you're able to do that for those patients. So I think it's super important to make sure that you know those skills and don't be scared to get involved. So if you see a patient that needs help, or if you even see a CNA or someone else that just needs some extra hands, be those hands. If your school is willing and letting you to help other people, I don't see why not. All of my teachers have been super receptive of that. They encourage you to help the CNAs as much as possible because they are working so hard, and they are your right hand. So make sure you form those bonds with those people right away, because I'm sure you'll see them again and you'll be there for a few weeks typically for your rotation, so it's important to have that good relationship to start. Initially, when I started, I wasn't aware of that dynamic, and so I feel like that really like kind of hindered me in a way, because I didn't know what our limitations were, and I was kind of nervous. So like, make sure to be involved as much as you can. When it got towards the end of the semester, I was able to be more involved, and before I knew it, I was like giving medications, I was doing bed baths, I was ambulating a patient to the restroom, like just every little thing that you can think of. Just be involved as much as possible. Anything you're learning in class, anything you're learning like assessment wise from your teachers, once you learn that information, they typically expect you to be able to do that in the hospital, and to be able to like do vital signs if you ever had to do manually. They will ask you certain questions. It depends on your faculty in your school, but my teachers, they just try to keep us on our toes as much as possible. And make sure when you're going to the hospital to write out, at least the first few times, to write out what things you need to bring to the hospital, because it's so important to have those items. And I know so many faculty that will take off points if you don't have like a stethoscope, or if you don't have certain colored socks on, or your uniform isn't like set to the T. Make sure you always have your name badges from school. I have like a name badge with like one of the Sharpies on it. That's convenient as well. But I will also do another video about like what supplies I actually bring to the clinical setting, so that you guys could see that for reference. But just try to enjoy the time that you have in the hospital if you're able to go. And if you're virtual, I'm so sorry that you don't have that experience right now, but hopefully later on in your semesters that you'll be able to. I know things with COVID makes things kind of tricky, but right now I am in my pediatric rotation, and actually due to COVID, we are virtual for that aspect. But then I have maternal and I have med surg afterwards. So those ones I'm able to actually go to the hospital for, but dealing with children, they need a lot more restrictions, which I don't blame them at all. But I wish that we were able to have that experience, but maybe later on we will. So another thing I want to mention is that when you're in the hospital, so you'll have your day like a normal 8 to 5 sort of thing, or sometimes it's even shorter, like a 6-hour segment, depends on your school. But afterwards, they might have like a reflective thing where you have to either share your experience, or they'll have like a conversation with faculty. Like afterwards, you'll have like a group meeting, or they will even assign you something where you have to like write down the patient information, of course not using any identifiers for HIPAA rules. So after the day is over at the hospital, typically you'll have some sort of assignment to do related to what you did at clinicals. So you'll either have to write about your patients, and for us we had to like write about the pathophysiology, something about like their vital signs, and you're supposed to go check their vitals like every 4 hours or every 6 hours depending on the patient. So you have to like put that information down, and then it'll go over further in detail about like what you saw and what nursing interventions. Everything relates back to like what you learned in school. So like the ADPI sort of things, what sort of assessment process, what did you plan, what interventions. And it could be something as like a fall risk because, you know, they just had surgery, or it could be like risk for infection because again they just had surgery. So it doesn't have to be anything too detailed right now because you're just in the beginning stages of clinicals, but it's really not that difficult. And as you progress further, it'll become easier and easier. And just like anything else, practice makes perfect. So try to get involved as much as possible. I can't say that enough. So I hope you enjoyed this video, and if there's any other videos that you really want to see, please let me know. Like this video and subscribe down below. I can't wait to see you guys next time. Bye!